Good evening, good morning, everyone. A warm welcome on behalf of Columbia Global Centers. My name is Seden Gürlek, and I'm the Program Officer at Columbia Global Centers in Istanbul. Today, we are delighted to be hosting the second webinar of the Heritage of Healing in the City webinar series. This series is organized alongside the exhibition Finding a Cure in Istanbul, created by Melis Bektaş, and held in the Yaklaşım Tüneli in Istanbul between June 26 and July 19. The exhibit explored the concept of healing based on the issue of accessing health in a big city, from the time of cholera to the coronavirus. Within the context of the exhibition, today we are going to be discussing the role of healthcare reform in Turkey's secular nation building process, the medical topography beyond hospitals, and the past and present of the institutions, actors, and ideologies during the epidemic since the 19th century. Before starting the panel, I want to briefly introduce our three panelists. Burçak Özlüdil is an architectural historian whose research focuses on the intersection of psychiatry, medicine, urban architectural space, and uses of digital tools in these fields. She holds a PhD in urban systems from NJIT and Rutgers universities. Ayşecan Terzioğlu is a faculty member at Sabancı University, Cultural Studies and Gender Studies programs. Her research and teaching interests includes globalization and health inequalities, biopolitics, illness narratives, anthropology of the body, gender, and anthropology of the Middle East. Doyle is a professor of anthropology at Amherst College, whose research and writing explores the intersection of suffering, healing, and politics. Thank you very much again for joining us today. I would like to open up the webinar with Gabriel Doyle, who took part in the research project on the evolution of the notion of care in Istanbul from the 19th century epidemics until today. He will talk about the research and the exhibition and how it relates to our webinar series and our topics today. One final remark to our audience: you can direct your questions starting with the beginning of the webinar through the Q&A box. Gabriel, the floor is yours. Thank you.
Thank you very much. Hello, everyone. So I was taking part in a research project that we called Bizim Hastane, that you could translate roughly as our hospital. It was a collective work in which we attempted to gather different stories from 5 historical hospitals of Istanbul that were built in the times of cholera and the plague, and that were run by communal institutions. We started to be interested in the idea of collective care that these spaces could represent. And when the pandemic of COVID-19 started, we thought of using these hospitals as examples of spaces in which health and well-being are associated with a sense of community. Our research was then part of a larger exhibition that was named in Turkish İstanbul'da Şifa Bulmak, that we translate as Finding a Cure in Istanbul, in which 17 artists produced different works on the topic of healing, the intersection between collective and individual healing. The exhibition took place in an interesting place that was purposely opened for this event. It's called the Yaklaşım Tüneli. It's right under the Taksim metro station, and it was quite an interesting place to be in itself. In the tunnel, so it's this very long, 200-meter long tunnel, we showed, part of the exhibition was a very short documentary that we made on these stories of 5 historical communal hospitals of Istanbul. I will show a very short extract from this documentary, and that might help us to launch our collective discussion.
Biz orada yatıyorduk, yani kalıyorduk orada. Yer vermişlerdi bize. Babama, çünkü babam da Rus'tu, beyaz Ruslardan. Ne zaman 1917'de geldi buraya, lisan bilmiyordu. Rusçaya en yakın Bulgarcaydı. Bir orada Bulgar hastanesi var, orada bir iş bulursun. Babam da gitti orada. iş buldu. Önce bulaşık yıkadı. Sonra da baştakçı oldu. 50 sene orada baştakçı. Oradan emekli oldu babam.
Bir de mevluthanemiz vardır Balat'ta ki rahmetli olanların mevlutları yapılmıştır orada. Yemekli mevlutlar yapardık. Artı özel olaylar, sünnetler, bar mizvalar gibi önemli olayları da orada yine kutlamışızdır. Muhakkak ananelerimizi yapardık. Mesela bir Purim'de muhakkak sultaniyotlarımızı yapardık. Hep birlikte şarkılar söyleyerek geçirirdik.
Bundan 2 sene kadar evvel bir Ermeni bayan geldi, Ermeni oğluyla beraber ve benden marul istedi. Ben de bunun tohumunu istiyorum. Nedenmiş o? Biz Ermeni hastanesinde Paskalya'da oradaki hastalara marul ikram ederiz. Ama Gidikuli'nin marulu meşhurdur.
Hem kilise hem hastane. Hastaneden sonra da seminarya diyorlar Bulgarlar. Papaz okulu vardı orada. Ve bir tane de futbol sahası vardı. Papazlar, işte kim istiyorsa orada bir takım kurmuşlardı. Babam da bu takımda futbol da oynuyordu o zaman. Gençti tabii babam, 18, 25-30 yaşlarındaydı.
Okay, so that was a short extract. Sorry for the complications. Now I'll leave the floor to Burçak.
Hello, everyone. It's my great pleasure to be here with you today. Let me start sharing my screen. Can you see the screen? Okay. And I'm looking forward to this wonderful conversation with Gabriel, Ayşecan, and Chris today. And thanks everyone for joining us. So we will talk about, and I will specifically talk about the relationship between health, disease, and space. And that I mean by that is urban space and spaces of healing. And so, we use these terms such as health, disease, hospital with such ease. And there is, generally speaking, a consensus on their meanings today, right? We understand what we mean by that right now. And we typically think about them as ahistorical and within the objective realm of the medical sciences. Yet, health and disease and how we define and deal with them differ throughout history. So even when we acknowledge this as scholars, it is quite difficult to think and talk about them when our views are predominantly shaped by modern medicine, because that is our frame of reference. And this is very much true about hospitals. The role of hospitals in theory and practice of medicine is an important question to think about. The centrality of hospitals in the development of modern medical sciences, occupying a state between the preceding library and bedside medicine and the subsequent laboratory medicines, presents a certain position in medical history. And this is a prevalent view and is a sign of specific importance to hospitals in a linear Western progressivist narrative. Yet, hospitals were not and are not static institutions. They change based on demand, scientific knowledge, medical practice, society, culture. And accordingly, I think we need to also revise our perception of their purposes to a broader and fluctuating range. In a way, the problem is that of naming, right? Especially when we talk about historical hospitals, we call an incredibly diverse range of institutions as such. We call them hospitals. And this range is both in terms of time and in terms of geography. For instance, a house with dedicated rooms to the ill, we call hospital. We call like later state hospitals, and then, we try to make sense of them. And but let's talk about the Ottoman Empire for a little bit. So the official spaces of healthcare in the Ottoman world were the Darüşşifa's imperial hospitals, I'll translate them as, that were charitable institutions supported by pious foundations, that's vakıf. And the imperial Ottoman hospitals employed health professionals and medication and were built with the intention to function as medical establishments. What exactly that intent is not as clear though. So although primary resort for the sick, imperial hospitals were not the only receptacles for them. In fact, hospitals were marginal in the Ottoman healing scene. As in early modern Europe, home treatment was the primary means to take care of the sick. So if you look at the numbers with an estimated population that ranged from 300,000 to 700,000 in the 16th century Istanbul, it had only 4 imperial hospitals, right? You can see them on the map. So we have Fatih, Haseki, Süleymaniye, and Atik Valide imperial hospitals here. And the hospitals could only have served a very small proportion of the population. And by the 17th century, only 1 additional hospital was founded, that is Sultan Ahmet in the Ottoman capital. So that means hospital comprised but 1 component in a complex network of medical aid, including family, community, fraternities, Sufi brotherhood, monasteries, seminaries, right? It's a very complex scene, and it's almost like an informal network that we don't kind of have a very good sense of today. And I think we'll come back to this. But so let's go back to these hospitals for a minute. So we tend to think about them in certain ways, right? And represent them accordingly. And that is, they're typically abstract. We think about them as empty, and we think about them as backdrops. And here we see actually 3 major imperial hospitals that are all still standing. We have Haseki, Süleymaniye, and Atik Valide, and they're all by Mimar Sinan, like so, masterpieces in quotation marks. And these are also were real extant and lived spaces with people in them. And here I'm really talking about literally actual people occupying, visiting, or studying these sites. It is through the quality of spatiality then that I connect the 2 areas of knowledge in the Ottoman world, medicine and architecture. So these were lived spaces populated with various types of inhabitants. Some passed through, some stayed for longer periods, some worked here during certain hours of the day. And this is very much in line with what Gabriel just showed us, right? About the people in them that we can trace specific stories. It's not as easy always though. And once populated with people and other living beings, such as plants, animals, for instance, think about these hospitals without pigeons, right? You cannot even imagine that. And the resulting sounds, smells, our understanding becomes more experiential. So here I'm showing you hypothetical reconstruction of Atik Valide Imperial Hospital. And this is based on the endowment deeds, like how many staff members were there. So the people you see here, the actors are color coded. So it gives us, and again, the number of patients, the yellow figures are patients. And the number is kind of coming from the fact that, I try to identify which rooms were patient rooms, so how many it could accommodate. This is, so it's a rough number, but I think it just helps us to contextualize it a little bit better in the sense that, if everyone was in the courtyard, what would it have looked like? And I started using digital tools and methods such as this one as I tried to reconstruct the life in these spaces. Being more than mere visualizations, these 3D simulations help us populate and get a glimpse of the everyday experience of their inhabitants. Patients, caretakers, cooks that are typically voiceless. But also that of physicians that they do have a voice, right? They talk about, but they always talk about, the kind of the science of it. But also with this, we can also get a sense of the corridors that they walked every day, right? The doctors' rooms that they occupied. So as the status and function of imperial hospitals started to shift from the end of the 18th century to the 19th century, the story became even more complicated. However, they continue to be located at the intersection of paths of their inhabitants, medical professionals, visitors, and imperial surveys. And it was these very spaces of healthcare that became the first official insane asylums of the Ottoman Empire. So here we're looking at Atik Valide complex, the one that we just walked through. This part is the Darüşşifa part that we entered. And you see it gradually being transformed into the Toptaşı Asylum that it was, later called as, and actually the building as we know today, right? And that there's this transformation happened like between 1870s and 1910s. And this is really my current project that came out of the doctoral work on the creation of insane asylums in the Ottoman Empire. So the repurposed imperial hospitals continued to function as such until the patients were transferred to Bakırköy Mental Hospital in 1924 to 27. And I'm going to stop and turn it over to Ayşecan, and I think we can come back to some of these points going forward. Thank you.
Okay. Hi, everyone. So, I mean, my slides are not as technical as Burçak's slides, but I just want to share them anyhow. Just to, okay. Hello, everyone. I'm going to talk about something a little bit different, actually, than just hospitals. I want to start with similarities and differences between how epidemics were experienced in the late 19th and early 20th centuries in Ottoman Empire and later on in the earlier decades of the Turkish Republic and COVID-19 of today. So I'm going to bring the topic a little bit to today as well. So what were the main similarities and differences, especially in terms of the embeddedness of politics and like political social inequalities and medical inequalities, like embeddedness of politics and medicine, and what actually can we learn from these similarities and differences or continuities and breaks? What do they teach us in a sense? And we know that as, I mean, since I'm not a historian, there are many historians. I realize that in the attendees and as well in the panel. I'm a medical anthropologist, so I'll look at from that point of view. And we know that in the late 19th and early 20th century in the Ottoman Empire, not just in Istanbul, but in many places in the empire, there were a series of epidemics which really damaged the economic social structure, it caused political tensions, and these were mainly, some of you already mentioned, like plague, cholera, and there were also diphtheria, typhus, influenza, and syphilis affecting different parts of the population back then. And of course, it was a time, late 19th, early 20th centuries, were time of political turmoil as well, besides the epidemics, because, you know, it was the decline, you know, if you accept that paradigm, or like the times, the last decades of the Ottoman Empire, and which got transformed, you know, to Turkish Republic, although it wasn't, of course, a smooth transition or transformation. It was a series of wars which actually embedded with pandemics or epidemics really problematically as well. And if we look at today, we see some interesting similarities, although we don't have a series of epidemics. We have one large pandemic, COVID-19, but equally in the whole world and in Turkey in particular, we see a time of political turmoil, social political crisis, and as well economic crisis. So as I said, I'm going to, I mean, just a snapshot because I don't have that much time. So just a brief account, mention the two time periods in terms of continuities and similarities, how in terms of how medicine and political ideologies embedded with each other, and how actually health policies back then and today, they're informed by not just geographical inequalities or geographical asymmetries, but also class and status inequalities. And as I said, of course, there are similarities in terms of political economic situation, but of course, today we have major differences compared to late 19th, early 20th centuries, because medicine evolved or developed a lot. Now we can talk about medical technology, digitalization of medicine, and also in terms of genetics, we can talk about the new vaccinations and so on. So there's so many medical developments compared to late 19th century. But of course, in terms of how health policies are affected, we can talk also about global neoliberalism, which caused privatization, opening up private medical schools and hospitals. So these are basically the points I'm going to talk about briefly. Okay, so the first part I'm going to briefly mention as my sources. Since my master's years onwards, I collected from the secondhand bookshops and so on, lots of doctors' autobiographies and memoirs, both from Ottoman Empire, Turkey, and also some French and German doctors invited by the sultans at that time or by the walis of that time to Ottoman Empire. So the first part I'm going to be based on their autobiographies, which you see here two covers, Hekim Aşkı and Bir Beyaz Gömlekli'nin romanı. You see here in these covers the idealized doctor image as the scientist. And of course, I could talk about gender here, the scientist guy, but gender is a whole another issue, but probably hopefully in another talk, I can mention those things. And you see a nurse behind the doctor here in Burhan Öncel's book and so on. So in those books, the doctors talk about their actually university years onwards. How did they get to the medical school and how did they experience introduction of biomedicine and new medicine from Europe to Middle East to Ottoman Empire and Turkey, to be more precise, and how biomedicine itself is politically and institutionally established. They talk about these. It's again a very difficult process with lots of ups and downs, never a smooth process. Okay, so I kept talking about biomedicine. So biomedicine is basically right now, it can be talked about as the most international, cosmopolitan, institutionalized medical discourse, practice, and technologies. And it is based on modern biology, physics, and chemistry, and medical scientific experiments, working on cadavers are very important biomedical practices as well. And as I said, in the 1870s, it was establishing as the medicine in the Middle East, thanks to or as a result of doctors invited mostly by walis and sultans from Germany, Austria, and France, and so on, to modernize the existing medical institutions. So these invited European doctors opened up new hospitals and medical schools. And language of instruction in those medical schools was German in the military medical school and French in the civil medical school. And over there, very different than Darüşşafaka, a new cadre of doctors were getting raised. And the medical education in those new medical schools were getting more and more standardized and formalized, taking the example of medical school educations in Europe, but adding also Arabic and Persian language and literature to localize the medical knowledge. And as I said, in the biographies, there was a new type of medical student with a new, actually self-induced mission, as Adnan Adıvar, Dr. Adnan Adıvar talks about it. The medical students back then have a strong sense of solidarity and community, and all together with their self-induced or self-inflicted mission, they tried not to solve just medical problems, but also social and cultural problems which prevent modernization and westernization. So it was their medical professional mission, which they are inculcated by their also professors and by their classmates from medical education onwards. So as a result of that, after graduating, they got really active roles in the successive parliaments and parties in the late Ottoman era, and more importantly, in early Turkish Republic with that mission. And they were really politically active as well. But before that, before even being active in Turkish politics, right after graduation, in different periods of time, they had compulsory medical service, mecburi hizmet, in Anatolia from the later, last decades of Ottoman Empire. And it was also true for some decades in Turkey, though it changed a little bit of meaning and so on. So after graduating from medical schools in Istanbul, the doctors had to serve in Anatolia. That's how they were generalizing. And they thought that that professional mission to modernize and solve all the problems, social cultural problems that prevent modernization, even at the compulsory medical service. So they were allocated, they were distributed to different small towns and villages. And this was a part of the policy actually to reduce the geographical inequalities in terms of distribution of healthcare services and staff. We can say that actually this geographical inequalities, when we look at it, it's in the first look, it looks like Istanbul versus Anatolia, or Istanbul versus the rest of Ottoman Empire, or later on Turkish Republic. But the reality is a little bit more complicated than that. So, as I said, there was a very important geographical inequality, and also which corresponds, or which is embedded with social political inequalities as well, because most modern biomedical hospitals, when they were opened, first prioritized the health needs of the army, so that the soldiers could get well so quickly and become taburcu, so that they can go back to their tabur, the platoon, the army. Or when there is, epidemic in the army, like syphilis, so that it can be treated quickly, and the army do not spread out to the villages it passes by, or from soldiers to their partners and so on. So in that sense, the army, with the needs of Ottoman Empire to win the wars over Europe, got prioritized in terms of healthcare access. Then the elites in major cities were prioritized in terms of opening up modern biomedical hospitals in 1870s. I'm talking about a little bit later on than the period Burçak talked about. So as Burçak said, the meaning of hospitals were changing in the introduction, during the introduction of biomedicine, but slowly. So Istanbul was prioritized. The elites in Istanbul was prioritized. And similarly, during the times of epidemics, which I mentioned, quarantines and vaccinations were implemented much better in major cities. So not only modern hospitals, there was this asymmetry in terms of existence of modern hospitals, but in terms of medical practices like quarantines and vaccinations, there were inequalities as well, because there were more medical staff and supplies in major cities. Now, this reminds us so much of COVID-19, and when we look at the Turkish map right now and look at the vaccination ratios, we see that Eastern Turkey, the ratio is unfortunately much lower. So these inequalities or asymmetries still unfortunately exist in different degrees and shapes. So similarly, not only hospitals or medical supplies case, but medical students in these new modern medical schools were mostly sons. Of course, women came much later, sons of elite, upper class and upper status families. And the medical students were often born and raised in Istanbul. They only went outside of Istanbul for vacations in Europe or, further medical specialization or training in Europe after graduation. And as also Gabriel and Burçak mentioned, they were mostly, many non-Muslim medical students and doctors who wanted to work on non-Muslim, like Armenian and Bulgarian hospitals or Jewish hospitals. The reason they were elite and mostly non-Muslim was because, as I said before, the language of instruction was either German or French, and the elite families were already teaching their sons from really early onwards these languages so they could follow, and non-Muslims as well. They had more advantage in learning these languages. And there is a question of affordability too, because there was no tuition as today's private medical schools like in today, but affording your son not working for 5-6 years but going to school was something like high class, high status families could do. So these privileged sons, when they graduated for their compulsory medical service, they went to Anatolia for the first time. It's one of the few times they get out of Istanbul. And in the books that I collected and I read, the autobiographies, memoirs, and biographies, they generalize Anatolia as an undeveloped place, reminding them the Middle Ages, inflicted with epidemics, poverty, oppressive religious traditions, very similar to these classical Bildungsromans, Bildungsnovels like Yaban and Çalıkuşu. So the heroic doctors go to Anatolia from Istanbul to modernize, like white man's burden, like internal colonialism, to save these places, to modernize these places. And from 1870s to 1930s, this saving and white man's burden accounts remain. And the contrasting of Anatolia to, the Middle Age Anatolia to modern Istanbul also remained for all these decades from 1870s to 1930s. Of course, this generalization and contrasting are highly problematic. I'm just going to talk about two problems related with that, and they don't really correspond to historical realities. Of course, when you look at more closely, the major problem is that Istanbul is really problematic in terms of embeddedness of medicine and politics as well, because there are health inequalities, healthcare access problems, and protests in Istanbul related with epidemics too. For example, when we look at memoirs and autobiographies of invited French and European doctors, they complain a lot about budgetary problems, not much money allocated for establishing new buildings, classrooms, laboratories, and intellectuals of that time, like Namık Kemal, wanted to transfer medical education from French to Turkish, but there's not much money for translations of these medical books into Ottoman Turkish. So money is always a big problem, and local people protesting is a big problem, especially in the laboratories, which started to work with cadavers protested by local people in Istanbul. They ransacked those laboratories, broke the window panes and windows of glasses. So French doctors say that, because they're traditional, they say that it's against Islam to work on cadavers and so on. But let's think about this vaccine hesitation of today's COVID. Whenever there's a new medical technique, a new medical discourse, it is, okay for people to, doubt about it and to say whether it's a, beneficial thing for you or not, So there are certain continuities and patterns, and to say that, oh, they're just so conservative and religious, they don't understand from modern medicine, is not the efficient solution. We have to go deeper, go beyond that, actually. So quarantines also were protested as they disrupt economic and social life, especially in big cities like Istanbul and Izmir, and forced hospitalizations, although, hospitalization was changing meaning. In the epidemic's time, mostly poor people were forced to get hospitalized, and their families were incarcerated, whereas the rich, high-class, high-status people could hide their illness and could invite private doctors to their home to be treated. So this is another social and economic inequality which is highly visible in the cities. And as I said, similar to working on cadavers in laboratories, first mass vaccinations, which started in the late 19th century, were also protested and resisted by conservative people, conservative in quotes, mostly referred by doctors as such, and religious people similarly. And there were also some coordination problems, in implementing quarantines, distribution of medical supplies like vaccinations, very similar to today's COVID-19. And similarly, politically, as it's a time of turmoil, back then, in that transformation from Ottoman Empire to Turkish Republic, there was a huge problem related with refugees, because Ottoman Empire was losing wars back to back, and from the lost lands, after the wars, the refugees were coming in masses from Balkans, Middle East, and Russia, and they were blamed of spreading the epidemics and also increasing the medical needs, especially in the big cities. Sometimes there were so many that they were kept in masses in the mosques and so on. Okay, this was the first problem. There were problems in healthcare inequalities or problems in Istanbul as well. The second problem is, of course, those who studied world system, they would remember the center periphery model, but when we look at healthcare asymmetries, healthcare access asymmetries, we see that there's not just one center, Istanbul, and its periphery, Anatolia, or Anatolia plus Middle East, but there are multiple centers and multiple peripheries in different regions in accord with the vilayet system and Ottoman Empire. And in vilayets, there are similar geographic inequalities. For example, when you look at Ömer Dawaji's book, Ungovernable Life, you see that, in Iraq, Baghdad and Basra were coming out as the major cities where biomedicine is more established. And in Khaled Fahmi's book, in Egypt, Cairo and Alexandria stood out. So I have the covers of the books if you are interested in multiple centers and peripheries, Ömer Dawaji's Ungovernable Life, and in Khaled Fahmi's book, there's Quest for Justice. He talks about this multiple peripheries and centers in Egypt. Okay, so a little bit moving on in history, let's found Turkish Republic. When Turkish Republic was founded, it inherited some of these problems which I mentioned, but it also, in terms of public health especially, the policymakers tried to solve these problems at political and institutional levels. So doctors' mission to modernize and westernize were not only self-induced, but also early Turkish governments gave them that mission, allocated them that mission. So it's important. And we see that contrast between Istanbul versus Anatolia. turns to West versus East in Turkish Republic. And in the public health, they have Samsun from the north and Adana in the south, Samsun-Adana line where they draw. And East was seen as the least developed place in terms of medical healthcare access and also politically and socially in the earlier years of Turkish Republic. Especially, I'm going to talk about really briefly right now because I know that I don't have much time, especially in 1920s and 30s and 1960s, two major public health initiatives were started, and they are so important that even battling with COVID today, their legacy is so important, although their institutions transformed or shut down right now. So these public health initiatives started in order to fight with epidemics of that time and also decrease the geographical inequalities in terms of healthcare services. So in late 1920s and 30s, mass vaccination started. Preventive health became really important. Health education through magazines like Gürbüz Çocuk or door-to-door education of health, good health behavior and so on started. So Umumi Hıfzı Sıha Kanunu, even the name suggests that general protection of health, so important. And of course, in 1940s, although Turkey didn't join the Second World War, but it had economic and political crisis. So these public health initiatives largely slowed down and ended in 1940s. But they were caught up in 1960s with sağlıkta sosyalizasyon, socialization and health, so that every citizen can benefit from healthcare access. And we see that in these two times, in 20s and 30s and 60s, these two periods, there is this close professional collaboration between doctors and politicians. And as I said, although these institutions or these policies largely got transformed or stopped, their legacy is still important. So when we look at modern times, we see it's like two steps forward or three steps back. And why did they get shut down or did they stop? If we ask, of course, 1980s were a totally different period where globalization and neoliberalism, kind of like became dominant paradigm in politics, and very rapidly healthcare institutions got privatized. There are lots of new private medical schools, private hospitals, both in Istanbul and all over Turkey. And that means less budgets for state hospitals and medical schools from the state. And most importantly, not just practical implementations, but with the neoliberal view of health, it transformed from health as a basic human right that everybody who lives in Turkey, refugee, citizen, whatever, can benefit. Health is transformed from basic human right to individual responsibility. And accordingly, lay people, in the privatized system of neoliberalism, lay people, the doctor said, or health policy makers said, lay people should allocate all of their social and economic resources to stay healthy. So patients are even more stigmatized and marginalized. When lay people get sick, they are more stigmatized and marginalized, thinking that it's their own fault, they did something wrong. So even public health became individualized starting from 1980s onwards. And of course, with the private medical schools and there are lots of medical schools opened up in different parts of Turkey. Medical profession also heterogenized, in terms of socioeconomic background and political ideology, starting with 80s. So it was no longer just mostly elite with the mission of modernizing country. Many people became doctor for different economic political reasons. Of course, the last blow was to socialize medicine, or socializing medicine, was 2000's sağlıkta dönüşüm, transformation in healthcare. Although it had some good aims initially, to have less bureaucracy by joining different insurances, more digitalization, more bringing technology to medicine, and to provide more lay people access to private hospitals with public insurance. These nice aims were partially realized, and it had the transformation in healthcare had some unexpected results, like right now when we see, and especially more during the pandemic, COVID-19 pandemic, the ideological tensions between government and doctors, like Türk Tabipler Birliği, professional chamber of physicians. So most of the time, because of the problems of the system, medical staff is blamed by the government. So as a result, we see an increased violence, even in the COVID times, against doctors and nurses. So the political cooperation of 1920s, 30s, and 60s was largely gone.
Ayşecan,
I'm just finishing. I need 2 minutes. Yeah, so thank you. So sorry, I know I talk too much, but these are the issues I get really passionate about, sorry. So, and with the primary healthcare, which is so important in preventive care, we see family centers instead of sağlık ocağı, which became family health centers, which became more conservative in terms of like birth control methods and tools becoming less available. And we see that despite all these public health interventions, the inequalities, geographical, economic, and social political inequalities still remain. So as I said, the history of embeddedness of medicine and politics has ups and downs, and it doesn't have a consistent long-term policy and institutions. I was going to talk about the lessons we can draw from these ruptures and continuities, but I'm leaving to the discussions because I'm way out of my time. So sorry, but thanks for listening. Okay, so I pass to Chris Doyle.
All right, thank you. Can you, yeah, there you go. Great, thank you. And I think we're going to try and extend this a little bit so we have a little more time for a Q&A. But just, first of all, thanks for those involved organizing this. And this is really, as you'll see, there's a lot of interconnections between our various interests. So what I'm going to say today, I'm going to talk a little bit about those who are typically left out of the conversations about healthcare and healthcare reform in Turkey. So in my book, Healing Secular Life, Loss and Devotion in Modern Turkey, I explore a wide range of healing practices and sites that fall outside of mainstream biomedical healthcare, the healthcare system in Turkey. So I work with Quranic healers, living saints, tombs of dead saints, and others regarded as having inherited the gift of healing in some way. In the process of researching the book, I became interested in why these figures attracted such intense public hostility, where they were attacked as being ignorant, backwards, superstitious, regressive, heretical, exploitative, and so on and so forth. In an effort to make sense of this hostility and the ways that these forms of healing were being marginalized, I would find myself in the archives trying to piece together a history of biomedicine in Turkey that focused on its role in the state's project of nation building during the early years of the Republic, and how it consolidated its power over a new citizenry through a discourse of science and medicine, a discourse from which the figure of the religious or traditional healer was actively cast out. Indeed, I would come to regard these healers as not merely being marginalized, but in fact exiled. And I frame it in the book as exilic forms of religious and therapeutic life. In the book, I was interested in tracing how the legacy of this history lived on in intimate relationships between patients and healers. So when I was asked to join the series, I found myself returning to the book's conclusion, where I spend time puzzling over this document. I'm going to share image. So I spent some time puzzling over this document. I call it a fragment. And I think it speaks directly to the themes of today's series, or today's discussion about healing in the city and rethinking it. So I'm just going to read quickly the last few, well, from the conclusion of the book, and just where I sort of talk about this image for a little bit. Just a couple pages here. All right. So on January 15th, 1938, the Ankara Development Directorate approved a request to appropriate Block 28, Parcel 6 for the construction of a widened boulevard running through what some now refer to as Old Ankara. This petition is but a small fragment of an enormous trove of such petitions that were submitted during this period. For the new city planner, the streets of Ankara were in desperate need of rational, modern order. In this petition, the planner's rendering of the parcel contains both an outline of the proposed boulevard's expanded dimensions, as well as the outline of an existing structure that was to be demolished to make way for this expansion, a structure that the document identifies as the Turbeyeri, the site of a tomb or a shrine. According to Law 1351, passed in 1928, the Directorate had the right to seize such properties, especially those of religious orders. Once the request was accepted, the tomb was purportedly relocated. This image, or this fragment, speaks towards the exilic, a dead saint in the surrounding shrine to which visitors regularly traveled, worshiped, and sacrificed, were cast out of the order of the city. Their exile was to be a precondition for a rationally ordered future of the city. This moment, as I read it, rehearses the wider and no less methodical diversion of a collection of religious practices and forms of religious authority to the outside of a national order in the name of secular reform and societal regeneration, a civilizational impulse that was felt with particular intensity during the early years of the Republic. As the campaigns of scientific and medical literacy that emerged during this period illustrate, society's secular modern development would require an alliance between science and secularism that medicine made possible. In these interdependent projects of societal and medical reform, which were at once projects aiming to undermine inherited models of social authority, habits of thought, and forms of social relatedness, the figure of the religious healer would come to assume a privileged place. It is here where experiences of injury, affliction, and suffering were marked in advance as sites of new and future struggle. And it would be the scars of this past of medical and secular reform that I would time and again encounter as people I spoke with both maligned and sought out the forms of religious and therapeutic possibility that the figure of the religious healer embodied. This book, in a sense, has been an extended reflection on how to listen to and for this history. An unavoidable and perhaps obvious lesson to draw from this history of secular reform, when approached through the contemporary forms of therapeutic desire that have concerned me, is that these sites of future struggle would in time take on a life of their own. While traces of this history would appear and reappear in both the intimacies of therapeutic relationships and everyday conversations about religious healing in the two Gecekondu neighborhoods where I worked, they nonetheless appeared under unanticipated conditions, which in turn offer their speakers a new language. That is, although the figure of the religious healer continued to play a defining role in inscribing and enforcing the limits of community, the religious healer simultaneously attracted a range of social anxieties and gave voice to a panic about the future viability of the contemporary political order. If we take this fragment out of the context of its submission to Ankara's Development Directorate, which secures our reading of its temporality, first a tomb, then a boulevard, it invites us to imagine differently the topography of the city. Rather than a rationalized cityscape, now and again ruptured by the appearance of a long-buried remains of an ancient presence, the stories of healing and being healed I have gathered suggest an underground existence, as Michel Desserteaux would put it, that has never actually left the city and continues, however obliquely, to haunt the present. If for a moment we give priority to spaces such as the Turbe in our visions of the city's landscape, allowing the city's more recent construction to recede into the background, bringing into relief the numerous tombs scattered throughout the city as a living network of devotion, indebtedness, social obligation that exists within the order of the city, we can imagine this fragment as posing a challenging question to its audience. Can one imagine a visit to the turbe or to the religious healer not as the traversal of a partition of time and the exiting of the city, but rather as a movement across a threshold of relatedness? So I know we have really limited time, and I think I'm just going to end with that kind of abstract note. And yeah, I'll end there. And so I'll open it up. I'm not sure what we're going to do now in terms of extending this, but the plans had been for the 3 or 4 of us to kind of have a conversation and then invite the audience to submit any questions they might have into the Q&A. So maybe we're going to begin amongst ourselves here, a little conversation. Maybe I'll just start off. I have a question. I mean, I think they're both, I think these 3 commentaries or comments speak to each other in all kind of different ways. So that we could talk a lot about this, but Burçak, I was really, struck by the not only the architectural plans, but the digital modeling of the spaces, right? And this idea of trying to think about them experientially, like what I mean to inhabit these spaces. I'm just kind of wondering, in your sense, I mean, this may be beyond this kind of time frame you're working within, but you get a sense of in the past, a much more porous sort of space, right? Where it's not like a hospital, we didn't think about it, but a lot of different things are happening in those spaces, sounds, etc. Is there a point in which you can see that the architectural design or the structure of these buildings get unified or consolidated? Or would you actually extend your point into the present in terms of hospitals are always kind of porous spaces and there's always a lot of things going on there? So
yeah, big question. so I'll try to answer some parts of it. So first of all, like I said in this brief talk, that when we talk about spaces of healing, I think like hospitals are really marginal when we talk about in the early modern world, and it's a much kind of informal kind of, it's all entangled together kind of, it's and we know very little actually. So that's how I got interested in how do these spaces, how were they being used actually, where do you enter, where is the pharmacy? So if I'm just gonna stop by, how does that work? That sort of those were my questions. And I didn't actually start by being interested in early modern hospitals anyway. I was looking at 19th century and I started coming back because I got to learn so much by studying the 19th century state of them, that I got more and more interested in that. But there is there's a certain time in the 19th century when Ottomans start saying hospitals shouldn't look like that. Hospitals should look like something else. And that is and even they start not seeing what they're doing, because they always have this ideal. And for during the upper limit period, obviously they do build those hospitals that they want to, and then those become kind of tools to show that the Ottoman Empire is not actually behind, it's catching up with the times, and there are these modern hospitals, and also they become signifiers of that. So there's definitely that. And then there is the pavilion type becomes the dream type, and it becomes kind of the preferred architecture, let's say. And so there is that. So there's definitely that breaking point.
Mm-hmm.
But also, I spent a lot of time in hospitals. My parents are doctors, so as a kid, and so what that did, and I really articulated it much later in my life. But I really knew hospitals from a different point of view, and those for instance, just like the imperial hospitals where they add rooms and they add another floor, the modern hospitals are like that too, right? They add a new wing, and you can't actually, if you only have to go to the second floor to get to that wing, and then, just need to know that, otherwise you can't find it. So so that's kind of one of the things that I find really interesting. So there is the perception when we look a building from the outside, right? So And that's really what architectural historians or architects are most interested in. So like, we talked about healing of art, the healing powers of architecture, all of that. But then, it starts to function and, there are new needs and they start to add things and it starts to become a little more, it's a little different as it was intended in the first place. So I kind of like that twist there. So while there is a move towards that, and there is like, I think that what's desired also changes, like mid 20th century, like now we have the block type. So it just kind of, if we were talking formally, it changes. But also like what I find interesting is that kind of that what happens in reality is that you change the hospital continuously, because the need changes continuously, and you cannot see it from the outside all the time, but it happens. So you just need to look a little bit more closely, and like that's why I call it closed reading of these spaces, to see those like nuances and how it's lived and what the experience is. So I think that is actually something that still goes on. I don't know if this answers your question.
Yeah, no, this is great. The question was kind of all over the place, but maybe here's a question from somebody who submitted to the Q&A. I think it's for you. And this person asked, was there a particular socioeconomic population that the hospital served over others?
Yes, so that's actually a very difficult question. And we know very little about it if we're talking about early modern Ottoman hospitals. So there is the theoretical answer to this, and you will see this over like kind of repeated all over again. Basically, it's open to all classes, it's open to all, everyone, regardless of your illness, regardless of your socioeconomic status. And it's not for people with like terminal diseases, so it's not a hospice. Like there are all these things that are coming from their endowment deeds. But again, like I turn and ask, like, who was actually going there? Like, we're talking about a very small population. And the general assumption there is that it's really those who do not have the support mechanisms that we talked about. So maybe who don't have families, travelers. So I think that we kind of know that travelers are like, they frequent the hospitals because they have nowhere else to go in the city. But also they go to like take kids. Like that's another like thing that we don't normally think about, but that's another location. But officially speaking, so that's the general assumption. It is that those without the means to have other kinds of support end up in the hospitals. This also changes throughout time. When we come to early 19th century, late 18th, then it becomes more for the poor. So they start changing as Ottomans start to think about hospitals in different ways. The users of the hospitals also change, and what they do also change.
Right. And also the practices of documentation too, right? The medical records and the storing of records. So that question is sort of a methodology question too, in terms of.
Exactly.
Yeah. There's a question here. I think we'll probably go to like 1:15 maybe. I don't want to push this too long in terms of people's schedules. But there's a question here for Ayşecan. So I was very interested by what Ayşecan Terzioğlu said regarding the resistance and protests against the first vaccinations. Could you please develop a bit more about this? Which vaccines, what kinds of protests, which sources? And this person references free health policy designers were underlined that the Turkish population opposed no resistance to BCG during the first mass TB vaccinations in the 40s. I don't know if you know this history very well.
Well, I can give another talk answering this, but I won't. Don't worry. I'll be really short. Merci, Lea. Thanks for the question, Lea. Actually, this is a very important topic, it's also concerning today. But whatever I read, from late 19th century onwards, vaccination hesitation or rejection is a recurrent theme, Claude Bey, in the French Claude Bey in Egypt complains about that. Then Dr. Burhan Öcal complains about that, about 1920s Turkey. And then Ercan Kesal more recently and Altay Martı, they complain about vaccine hesitation in 1970s and 80s, and this is especially for children's epidemics like kushpalazı, diphtheria, and but I guess, you know, this is not only, but also other epidemics as well, especially in children. The parents are hiding their children into their basements, especially in the villages, so that they don't get vaccinated, or children are escaping from the doctors who came from the West or from the city. So I think there's a little bit more than there's something a little bit more than hesitation against something, a new medical technology or a new medical implementation. I think there is also a mistrust against the foreigner coming from not only maybe European country, but also from the big city. You know, Halet Fehmi also talks about it, Leah, and I can send you the references of all these works I mentioned. So there is this element of mistrust against the, you know, medical staff and also the government that this medical staff is representing. But also, you know, as you said, like mostly in a political, if you read the government's treaties, like Ministry of Health treaties, that they keep saying that this mass vaccination was immensely successful and people collaborated fully in the official documents. But if you read the doctor's memoirs and biographies and autobiographies, it's a whole another story. Thanks. I think Gabriel has questions.
Yeah, thank you so much for the three of you. It was fascinating. I had two questions actually. One was for Ayşecan. I found interesting when you talked about the memoirs of these doctors. I found this very interesting memoir of Cemil Topuzlu.
Yeah.
I don't know if you've used it, but I think it's a good example also of the intersection between health and the city, because Cemil Topuzlu, who was a surgeon, then became mayor of Istanbul. And in his memoirs, he has really this, maybe you could talk about it better than me, but this what you mentioned, self-inflicting, almost civilizing mission that he applies in medicine, but also when he becomes mayor on the city, which I found an interesting example.
Yeah, I have a special place in my heart for Cemil Topuzlu because he is the first doctor who invited women students to his classroom, actually, informally, although they were not allowed. And Cemil Topuzlu is a very important person as well to talk about public health in the city and, you know, how to have the city infrastructure so that, you know, Istanbulites can live healthily. So I think we should still follow some of his legacies as well. So it's not only mission to modernize, but also mission to inculcate public health and preventive medicine in terms of city-based and city planning and architecture as well. So I think he's one of the very important people. Yes.
If I can just add.
Yeah, sure.
I can just add to this.
Yeah.
So like basically it's finding similarities between the human body and like the city is also a very common theme during this period. So you will actually like hear a lot of doctors and architects also too, or urban planners talking about, like, for instance, like the city being sick, or like the trees being the lungs, and then you cut open, and it's really like, you know, you can see those in like basically conceptualizing houses, like they work like bodies, and like there is the plumbing that's going on. So it's like this analogy between the body and the spaces that we occupy as humans is a very common theme during this period. So Cemil Topuzlu fits right into that, like many other Ottoman intellectuals.
Gabriel, I think you had other questions too, but I got too excited when you mentioned.
For Chris. Thank you very much for your answers. Now I was very interested in your use of the term exiled and not marginalized, and I wanted to know whether you mentioned that healers experienced some form of exile, but what about the users of these forms of healings? Could you find out more about not the healers, not the shifacı themselves, but those who believed or who trusted these forms of healing?
Yeah, I mean, I think you'll find so I mentioned, like, I mean, how this project sort of developed was initially nobody wanted to talk about religious healing. So I was living in a neighborhood, working in 2 Gejikano neighborhoods, and based upon the first few months of research, I was like questioning why I was even there, because nobody was interested, nobody believed in these healers, right? But lo and behold, right, you spend some time. This is part of like doing ethnographic research. You spend long enough time there, then you start seeing a different picture kind of come to the view. And I think that I read, on the one hand, I think there's a kind of a strengthening public discourse of open opposition towards these healers because of media campaigns and public health campaigns about just attacking these healers as being superstitious, ignorant, etc. Right? But, and this is true in most places, patients or people who go seek them out, they're much more flexible, right? In the sense that they're able to hold in at once 4 or 5 different frameworks, and it's not about one being right or wrong. It's just kind of doing everything, and especially when it comes like children, right? So you have your child's sick, right? You'll try everything, and it's not about like your belief or commitment to religious healing as an abstraction or as a category, but just like, my kid's sick, I hear that this person's really good, I'm going, right? So yeah, just this juxtaposition of the sort of rigid public discourse where you have this sort of, believe it or not, right? Versus the kind of lived reality of people's lives in which people are very fluid and flexible and able to sort of move around between these. And again, just to sort of underscore, my experience is like, it doesn't, people have like, you couldn't really pose a question like, do you believe in religious healers, right? That's not a question people have an answer to, again, it's like hearing rumors of certain people as being, skilled at doing certain things, and you're willing to try it just out of desperation or it's ease of access, right? That is easily accessible. So that's a short answer to a bigger question. Thank you. I think we're past I don't know how we're going to end this, but
yeah, great. Thank you very much for these great presentations and your time. It was a pleasure to have you with us. And thank you all for attending today, and see you in other programs in the future. Bye-bye.
Bye-bye.
Thank you, everyone. Have a good night.
Thank you very much. Bye-bye.